now I'm gonna go over our expert panel to give their input on how to give an effective presentation. Any highlight from your presentation, Dr. Leyton? And I encourage all the audience to ask questions, and we'll try to go through them as many as we can. Please, either you can raise your hand, I'll give you the mic to ask question, one question at a time, please. And the topic of the presentation today, you can also type your question in the chat box here or on the YouTube channel, and we'll go over with them. I'll start with Dr. الجهاني. If you guys ask our expert panel to turn their camera on and unmute themselves. This is Dr. المهدي, Dr. عبدالرزاق, and Dr. Rida. So let's do Dr. Jani, if you can unmute yourself.
Okay. Assalamu alaikum.
Wa alaikum salam. Welcome.
Thank you very much, Dr. Ayman. Thank you so much, Dr. Scott, for an excellent presentation. It's spot on. I don't really have much to add, but just to emphasize a few points. One of the things I'm sure a lot of audience find upsetting, sometimes not even distracting, that the speaker will give them the back and will look at the slides and just reads the slides. Well, if you're going to read the slides, you may as well hand out the slides and go home. So this is number one. And number two, sometimes you find a speaker focusing on a particular audience all the time, as if there is only one person in the audience, and that's it. Maybe this is perhaps a reflection of nervousness. So he wants, or she wants, one person to get the impressions from, doesn't cope with the impressions from so many people, therefore, as if they're looking to one person all the time. The third thing is repetition. Sometimes people repeat and repeat and repeat, which adds to the boredom. The other thing is I find, and a lot of audience find unwelcome, is people presenting copied slides. They're not putting any effort. They're just presenting copied slides, quite often from pharmaceutical companies. You find the slides at the bottom. It's clearly a pharmaceutical company slide. That doesn't speak well for the speaker. It also makes the audience think, is this guy biased or in favor of a particular company and a particular product beyond the clinical evidence? I agree with Dr. Scott about very busy slides. They just don't do anything. If they're there, you may as well put a blank slide, and the audience will do as well. I'll leave the time for my very honored co-hosts, and thank you so much, Dr. Ayman, again.
Thank you, Dr. Abdelrazak. Very nice input. I'm not sure, Dr. Leyton, if you want to comment on this very important point that he mentioned, especially like talking and reading your slide and giving your back to the audience. Then I'll go to Dr. Rida, then Dr. Al-Mahdi. Very good point.
Good. Agree.
Dr. Rida, any tips to our audience and any highlight from Dr. Leyton that you would like to emphasize to our audience in Libya?
Yeah, thank you very much indeed, Dr. Ayman and Professor Leyton, for a great session. I think I remember back in the 90s, there was a very interesting article published in the BMJ on how to make a bad presentation, which is a very fascinating way to look at it. And I think I would recommend our colleagues to read that paper. I'm sure you find it extremely interesting. And I think you find a lot of the points referred to by Professor Leyton have probably been mentioned in that particular presentation. The other questions I have really for Professor Leyton, is there an ideal time for a presentation? For example, I was asked to talk to the Libyan Cardiac Society last July about the guidelines for management of valvular heart disease, which is a few hundred-page document. and I was given 15 minutes to make the presentation. But I was saved in many ways by the guidelines sent by Dr. Smear to us, and he said, you didn't have to say everything, which was fantastic, really, great advice, and I highly appreciate it. And despite that, I tried to put in as many points as I could, but I wish I go back, I'll make less number of slides because it was a very busy presentation. So is there an ideal timing for a presentation? Full stop, number one. The other thing, you started off saying, it is not about you, which made me feel more relaxed and happier to go for my next presentation. But at the end, you said, well, if you think about the people who you admire most as speakers, and ask yourself how much did you remember of them? And I agree with you. We didn't remember much what message they made, which in one way made me feel bad, because I always thought whatever material I'm giving to people will remember it. And on the other hand, it is all about you. It's not really about you. So what do you say to that? Thank you.
Well, a couple things. First of all, if your goal is pushing 30 facts into somebody's brain in 30 minutes, you will fail every time, because we don't learn that way. And what you can do, though, you can do a lot with a presentation. You can teach an approach to a problem. You can teach a procedure. You can get funding for a research project if you impress the audience. You can position yourself as one of the better speakers and get invited back. But you have to have a goal that is not trying to cover all the guidelines. When you tell them everything about a topic, they will generally remember nothing. So what I often teach our younger doctors is, if they're trying to figure out how to put a big topic together, think about the audience. What do they want to know? What do they need to know? And start with your summary slide. So if in the summary, if you only remember 3 things as you walk out of today's discussion, I want you to remember A, B, C. Thank you very much.
And Dr. Leyton, just a quick disclosure for Dr. Rida's presentation was one of the best ones during our cardiology congress, just to kind of let you know. It was really amazing. Now I'm going to take it to Dr. Elkhammas to get his input. And Dr. Al-Mahdi, I really would like to get your input on the audience, because I've seen you over the year. I watch your YouTube channel on ethic, and it's amazing to me how you change your style and approach with the language, the approach to the Arabic speaking language, and the same thing I get the other expert on that. Dr. Al-Mahdi.
Thank you, Dr. Smear and Dr. Leyton. It was really a very nice lecture. I enjoyed it. I stayed awake the whole time, by the way, and I was not playing with my phone or Facebook or anything like that, which that's exactly what I do when I close the camera in a very boring presentation. In any case, I like to go ahead and switch to the Arabic language, as I told you early on, and maybe sometimes I'll switch back and forth. دكتور أيمن بارك الله فيك. أنا يمكن one more point, Dr. Leyton. I came attached to the presentation and the quality of the presentation around 1982 by Dr. Zollinger. I'm sure you remember Zollinger-Ellison syndrome.
Sure.
Yeah, Zollinger, as you remember. Yeah, he's from Ohio State, so he was. He always has a handout he gives to the residents on the first week, or maximum the second week. We had it, and he insists if you put more than 6 to 7 lines on per slide, you are setting yourself to failure. So that one engraved, you know, and for the last 40 years with me. أغلب الموجودين طبعا بيتكلموا عربي وإنجليزي، لكن أنا حبيت نعطي ملاحظاتي بالعربي. المحاضرة الحقيقة هي جيدة جدا، يعني ما فيش أدنى شك لذلك. لكن دائما نرى في المحاضرة أن هي نوع من التواصل. يبقى أنت عندك رسالة تبي تعطيها، والمستمعين عندهم أحدهم رسالة، ينتظر في المحتوى إيش بتعطيهم أنت. لأنه أحيانا يحدث نقاش بعدها، بالذات تو بعد عندي خبرة بالمؤتمرات في ليبيا وبالمحاضرات في ليبيا تختلف شوية هنا. فهي يمكن شبيهة بالوصفة الطبية. إذا كانك أنت الكتابة متاعك واضحة يبقى مش حيصير فيه خطأ. إذا أنت يعني نحكي في الوصفة الطبية، إذا أنت أيضا العرض متاعك واضح والرسالة اللي فيه واضحة، يبقى أيضا ما فيش حيكون فيه سوء تفاهم أو you misunderstanding or anything like that. قدر الإمكان لما تعطي محاضرة في ليبيا يجب أن تدخل فيها المصطلحات الإنجليزية وجزء من العربي، لأنك أنت بتعرف أن المستمعين اللي معاك في ليبيا البعض منهم لغتهم الإنجليزية غير قوية. ولهذا إذا كانك أنت بتتكلم دائما بالإنجليزي لأنك أنت تعودت على أوروبا وتعودت على أي دولة أخرى كل الأكتيفيتيز فيها بالإنجليزي، ففي بعض الأحيان رسالتك ممكن تريح شوي. وهذا اللي ساعدني فيه لما ركزت على أخلاق المهن الطبية في السنوات الأخيرة في ليبيا. وجدت أن من الأسهل أني أحكيها بالعربي. ما نحبش نكتب على الشريحة كثيرا الحقيقة، زي ما أشرت في البداية للدكتور ليتين، من 5 إلى 6 سطور. وأيضا كل شريحة بالكثير 2 أو 3 لازم يعطوا رسالة. وهذا الدرس تعلمته أيضا من المحاضرات اللي في ليبيا. علاش؟ بغض النظر عن أن الشريحة لما تكون مزدحمة زي ما أشار الدكتور ليتين مش حتعطي صورة ولا حتوصل رسالة، لكن اللي حدث لي أن في أكثر من مرة أن اللجنة التحضيرية أو اللجنة العلمية يقولوا لي دكتور مهدي أنت عندك 25 دقيقة تتكلم فيهم. فأنا نجهز في الشرايح متاعي على 25 دقيقة. وتعودت أنا دائما حتى الآن على الأقل ندير براكتس 2 و3. نحب نكمل البرزنتيشن متاعي قبلها ب4 أيام 5 أيام وندير براكتس لعند ما نضبطها بالضبط، ونخلي في دقيقة أو 2 احتياط. لكن وين المفاجآت تجيني؟ يعني لعند الأسبوع الماضي كانوا عاطيني 25 دقيقة نبي نتكلم على التعليم الطبي والنموذج الأمريكي للنقاش في ليبيا. وأول ما بديت نتكلم وصلوا حوالي 7-8 دقائق، قال لي راهو الوقت يبي يكمل، أنت عندك 10 دقائق. من 25 دقيقة إلى 10 دقائق طبعا في فرق كثير. فأنا عادة لا أخرج عن الوقت اللي هو معطى لي، ولكن لما تكون الشرائح الرسائل فيها قصيرة جدا وكل شريحتين 3 يعطوا رسالة، حتى لو انقطعت الكهرباء، لو انقطعت الانترنت، لو رئيس الجلسة كان يعني ما يحبكش واجد وقطع عليك الميكروفون، يبقى جزء من الرسائل متاعك انت تكون عطيتها. هذه طبعا خصائص من الصعب ان الدكتور ليتين يعرفها او حتى يفكر فيها، لكن هذه اللي تحدث عندنا في ليبيا لما يعدوك ب 25-30 دقيقة وبعدين يعطوك 10 دقائق. فكل شريحة
عفوا دكتور المهدي،
عفوا.
To your point about like what's a good number of slide for, let's say you have like a 1 hour presentation from your experience, okay, and we'll go over the expert panel too, because we have a question on the chat box about what you do when you have a short time. So, but if you have like, most of the time, like when you do those, it's a 1 hour session, you have like 20 or 10 minutes for question answer. From your experience, what did you find more effective preparing your slide, regardless of the topic, right? It's different. What's a good number of slides you recommend someone to prepare?
Yeah.
Well,
go ahead.
Go ahead. No,
so,
Dr.
Let's take Dr. Mahdi and then go to you. Yeah. Go ahead, Dr. Mahdi. Go ahead. Okay.
Number one, I really hate the 60-minute presentations. I don't like that. And most of the time, if it's a workshop, it's different. That because you are not really giving presentation, you take and give, and there is a discussion, that's a different story. I could say for hour and a half or two. But if you're just giving a presentation, I really think the attention span is good anywhere around half an hour or so. So if you, you can engage me to about half an hour, 35 minutes, I start getting boring. The 45 minutes, an hour is really too much, but I usually give myself around 30 seconds to about 45 seconds per slide. So if I'm giving 10 minutes of presentation, I could do it in 15 to 16 slides. So when I do my YouTube talks, I usually have about 30 slides for about anywhere 15 to 17 minutes.
Okay, thank you.
So about half, I would say half a minute to about 45 seconds.
45 seconds. Dr. Leyton, what's a good number for slide to prepare?
Yeah, you cannot put a number of slides. I've read books, they say 1 slide per minute, do this, that. I have given 20-minute presentations with 50 slides in them because it's not all the words. Sometimes it's a quick picture. Sometimes the slide has 1 line of text on. And sometimes you're moving ahead because you're not reading the slides to the people. So I think the most important thing is to practice out loud with a timer, speaking slowly. You know, we were talking, I speak 1 language poorly. So I'm impressed with those of you that English is your 2nd, 3rd, or 4th language. But one of the things that we share with many of our international colleagues at Mayo Clinic, one of their fears when they are presenting in English is they will not maybe be as well understood as they could be. And the key to that is speaking slowly, pausing, sometimes separating words. So there's no exact number of slides per presentation. Just practice in advance so you know you're not going over time in your comfortable, slow speaking voice.
Okay, very good.
I have a question to Dr. Leyton.
Go ahead, Dr. Mahdi.
About the same
and then
issue.
we'll take the audience. We have 2 questions from Dr. Abdulrahman and Dr. Muhammad.
Okay, Dr. Leyton, can you hear me well?
Yes.
When I was talking to the group in Arabic, one of the things that I faced, and I usually don't face it in the English speaking places, is that more than one time I was promised 25 minutes. So even though I have been in this business for 40 years, I always practice my slides and I always give myself about 2 minutes. And as you have mentioned, you practice slow and you give yourself time. So when I prepare myself for 25 minutes, then definitely I have more slides. And then the chairman of the session, more than one time, surprised me around minute 9 that I have a minute or 2, that around minute 14 that I have a minute or 2. They changed their mind either because of the previous speakers or whatever, or the communication between the chairman of the session and the scientific committee were not close. So which is best in this situation is that I try to give a message or 2 and stop, skip the slides and go to the last 2-3 slides, or try to go fast through them. Really going fast through them, sometimes it bothers me. I become nervous and I know I'm not really giving the message. I'm not being effective. Have you faced this situation before?
Well, I faced it today with the wonderful Dr. Smer had told me that I may have 40 minutes and didn't get started till about 12 minutes in. And so what I often do, if you, on your computer, if you have your final slide, the summary, you can hit, and what I did was I eliminated the workshop video of a young woman who I filmed, and I hit the end slide, and I went back 1 to get to the final summary and most people don't even notice. So I always, now the best thing, if you're giving a cardiology talk and you've got 4 or 5 cases and you don't have time to finish them all, when you're done with the 3rd case, if they're saying, okay, we got to move on, you can just hit to your end slide and hit to your summary. And then then you're not doing this with the last 18 slides. So you bring up a good point.
That's a great tip. And for the rehearsal, I need to go back to our expert panel, because as an expert giving multiple presentation, you feel comfortable rehearsing by yourself, you know your pauses, how to do. But if someone's starting your presentation, I think it's important to rehearse in front of a mentor or colleague to comment on your body language and your pace. But let's take Dr. Abdulghani ibn Wara. You can unmute yourself, then we'll take the Muhammad Zway next. Please, Dr. Abdulghani, one question at a time and to the topic. Thank you.
Okay, hi, Dr. Leyton. Hi, everybody.
Hello.
Thank you very much for the excellent presentation. I'm speaking from Canada here, and I really appreciate your talk and your time. I remember attending one of your talks actually live in one of the ACP conferences, and a couple of my colleagues and I wrote some of your nice comments and practiced them. It was very helpful. One of them I remember is to use your patch in the right upper chest, which is amazing. So the question I have exactly is to when you prepare for the presentation, it takes sometimes time, maybe several hours, and you need to summarize it in just to present it in a few minutes. Can you just tell us how to prepare for your presentation to make it really appealing in terms of the content, and also how to present it officially? You mentioned all the necessary points, but if you can just summarize that, please. Thank you very much.
Well, this might be a little off topic, but I teach many of our fellows and our new staff doctors. And I recommend to them that they just develop 2 or 3 presentations that they can give that will be of interest to the general audiences to whom they present. If somebody wanted me to come up with a talk about new cardiology drugs in the 21st century or 22nd century, I could maybe spend 8 hours trying to do that. It would be a tremendous burden and waste of time. So I have, and I recommend to others, just have several talks that are going to meet the needs of the audience. So from a cardiology standpoint, I would suggest many of you have cases from the cardiology clinic, and you have a number of short cases with a teaching point. And if you're aiming at family medicine, it can be at one level. If you're speaking to cardiologists, you can have more detailed cases, but then you can build your talk without having to spend hours and hours and trying to figure out what meets the needs of the audience. I worked in our anticoagulation clinic for a number of years. People would ask me to speak on some crazy topic, and I'd say, who is your audience? And they'd say, family medicine doctors. I said, oh, I have a better topic, cases from the anticoagulation clinic. It goes well. Oh, good, give that instead. So that's one way to save yourself hours and hours of trying to put something together.
To use the power of storytelling, right? Case-based approach. And now you go all this national meeting and world-known expert. This is how they start their presentation, with a case they came across with, and then they go over the data, over the guidelines, then they end up with their case. So I think that's a great tip, to use a case-based approach and the storytelling, and how to, this is the get the kind of your audience attention. Dr. Muhammad Zway, you can ask your question. Then Dr.
Assalamu alaikum. Assalamu alaikum jami'an. Thank you, Professor Leytin. I am Dr. Muhammad Zway, Associate Professor from Libyan International Medical University and head of the Department of Medicine. No doubt, Professor, that to have a proper medical education, we should have our tutors and teaching staff to learn well how to have an effective presentation. And this is still an ongoing issue that in our university we always stress on. And starting from introduction or the objectives, but I usually concentrate more on the closing remarks of an effective presentation, because this is the most memory lasting in our audience, so that what they remember from your talk is that your closing remarks, how much they are close to their level of knowledge. So I need your experience, how to formulate an effective closing remarks that can last long with our audience. Thank you.
Well, I'd be happy to hear from others, but what I always do and what I teach is to cue the audience, to let them know it's coming. So I like the words "in summary," and then people usually grab a pen. And if you only remember 3 important lessons from today's visit, think about: be organized, make sure that it's a performance, and you will be remembered far longer for your style of presenting than your factual information. But you can put any 3. That's what I used for today. But if it's important guideline recommendations, you'll pick out the best 3 or 4 and you'll emphasize them at the end.
Okay. So, Dr. Leyton, this is a very good question. Let's hear it from Dr. Rida and Dr. Elkhammas. Then we need to conclude. So I'm going to take a question from Dr. Adel Dayoub. Then I'll give a chance for the expert panel to kind of give their final remark, and we'll conclude with you, Dr. Leyton. Dr. Rida, you can unmute yourself. How about the question from Dr. Mohammed is what's the best way of how you formulate your take-home message, your summary, your final? What's your tips and technique to do that, so the audience can get out what's the most important thing from your presentation? Then we'll go to Dr. Mahdi after you.
I remember one of the best advices I had is when I had a presentation to give to the British Cardiac Society back in the 90s about memory artery grafting, I remember. And my consultant, my senior staff told me, tell them summarize what you want to tell them, tell it to them, and re-summarize it. So you are actually giving the message 3 times. So as Professor Leyton pointed out, you start with, you can start, of course, you need to identify yourself and so on, but then you start with the message. My message to you, if you remember this, you can forget about the rest of my presentation, for example, if it's not a bad statement, but then you sort of expand on it. Talk about your methodology or whatever results you have, and then you come back with the conclusion, which is in summary, which is as Professor Leyton has pointed out. But I'm still really interested to challenge Professor Leyton, who told me in the beginning it's not about you, but then at the end it's all about you. How do you reconcile that? Thank you.
Well, I reconcile by saying it's not about you showing how much knowledge you have by pushing lots of factual information at the audience. But it is about you, if you can meet the needs of the audience, if you can engage them with your speaking style, if you can motivate them or energize them to learn more about the topic, because they won't learn everything in your talk, but you want to motivate them, energize them, so they want to learn more about this. And you also want them to have a positive impression of you. And so from that point, it's important, but when you're putting the talk together, it's not about what you think is important, what you want to push at them. It's putting yourself into their shoes. What do they really need to know, or perhaps want to know more about the topic?
Yes, it's not about show off or regurgitating the knowledge. The knowledge is there, right? It's how you transition to them. Dr. Mahdi, about the take-home message, what's your tip to our audience when you formulate your take-home message? Then we'll take Dr. Adil question, then we'll conclude with everyone from the audience and Dr. Leyton.
I have a very simple message here. Listen to the recording of this presentation about 5 times, or each time you prepare a presentation, if you are in the first 6 years following your graduation from medical school, or if you are a medical student or anything like that. And then practice and practice and practice in front, in the beginning in front of a mentor, but after a while you do it yourself. And don't ever come to a point say, you know, I'm so good, I don't have to practice. Maybe Dr. Leyton can do it with this presentation because he has done it so many times. But each presentation has its a little bit different audience, a different flavor. I still practice until today.
Absolutely.
I annoyed my wife and I annoyed my children and I annoyed everybody. Nowadays, the last several years, I practice on my own in the basement or in my den.
And we all have one of these devices, and we can all film ourselves. Many of my students say, oh, I hate watching myself, but I'm really glad we had this workshop where I was able to see myself on film. And I really came across a little better than I thought I would, but there's things I need to work on. So don't be afraid to practice and video yourself and watch it, because that can be very helpful.
I usually open a Zoom.
Sure.
A Zoom session and record that, or I have a very nice software. It's called the ScreenFlow. I does the same thing. Can record the screen as well as your voice. I agree with you 100%. Or your phone. Yeah.
I think this is wonderful tip, Dr. Mahdi, about like watching this presentation 2, 3, 4, 5 times, and especially before you prepare presentation, because it's just full of tips, information, and discussion. I would love to continue on and on, but I know Dr. Leyton has commitment, and I want to be respectful for everyone's time. Let's take Dr. Adil's question. Will be the last one today, and then we'll conclude with everyone. Dr. Adil, go ahead and mute yourself.
Okay, thank you, Ayman. Thanks, Dr. Leyton, for such a great presentation. I have 2 comments or 2 questions. The first one is, I think coming back from when I attended one of these sessions with Dr. David Sackett, who is the founder of the evidence-based medicine at McMaster University. And I remember him telling us whenever he does involve in any research, he has what we call a writing day. So he goes to his office on Monday, exchange offices with one of his colleagues so he doesn't get bothered, and he sits and writes 3 or 4 abstracts. So the question is, do you recommend whenever you work on presentation, because you better have your train of thoughts in one, like you all focus in one day, do you recommend to finish writing the presentation in one day, or do you prefer to be fragmented into different days? Sometimes it takes forever to finish a presentation. Do you recommend just to dedicate a whole day for that? The second question I have is...
Adil, let's do one question at a time, because I'm sorry, we're short of time. At least we can keep the audience engaged. Dr. Leyton, you have a question to Dr. Adil's question?
Oh, well, I think that's completely individual. Completely individual. If somebody does better sitting down in a quiet room and working for 5 straight hours, and it's true, if you have interruptions, it takes many minutes to get back into the flow of what you were thinking. But I can't give a generality for that question. Different people work different ways. Again, I like my presentations to be segmented into small pieces. That's why I like case-based. So I think you could come up with a case with a teaching point in a short time, go back to seeing patients, think of another one. That's the way I work.
The other question I have is very quick. Sometimes you get into those presentations where the whole presentation is all journal slides, all the graphs and curves and tables. You hardly see much writing. So I think I found like you tend to be overwhelmed when there is the whole presentation, 90% is all like papers and all just screenshots versus like, 1 or 2, 3 lines. So what style you would recommend? Do you like you do 80, 20, or you do purely
presentation? In my opinion, presentations aren't journal clubs. So graphs and all these papers rarely help. Occasionally you want to do a quote or show a conclusion of a paper to give some credibility to what you're saying. But those graphs and complex slides will just turn the audience off. So they may want to read more about it on their own, but people will not remember all these crazy figures and graphs. That's when people go to their iPhones, not to record themselves, but to read their emails. So I would counsel against too many of those.
And Dr. Leyton, would be a good idea to kind of put a reference at the end of your presentation, right? For more resources for people to review.
Yeah, people love a reference, but they don't want to see 30 of them.
Yes.
So if there is a key reference that you want to share with people, 1 or 2, that's good. But I've seen slides where the last 4 slides are 10 references apiece. Nobody gets anything from that.
Yes, thank you so much, Dr. Leyton. I would like to take more questions, but I think we're out of time. I'll be respectful of everyone. I just want to share with you one of the texts from one of the medical students who attended with us today. She's very grateful to you, Dr. Leyton, and to our expert panel. And she's saying, basically, as a medical student, she does a lot of presentation, and this was very helpful to her. So we're glad. So this is not just for cardiology. I think any specialty can learn from this presentation. I would like to take less than 1 minute from our expert, then I'll conclude with you, Dr. Leyton. Dr. Rida, you can go ahead. Final remark. And mute yourself.
Yeah, I've just added one final remark, which is I find it very useful, is try to memorize your own slides. If you memorize a sequence of your slide, it makes it very easy and more fluid when you talk and make your presentations. But that will require that you prepare your presentation over a long time, maybe many weeks or many days at least. So it'll be difficult to do it within a set number of hours, as Adil was considering. That's all I have to add. And again, thank you, Professor Leyton.
And this is mistake I did. Like, never let your presentation to do it the first time at the conference or your meeting. You have to rehearse it. Do it before. So it won't be your first time. So you get surprises, you will lose the track, and that pace, what Dr. Leyton was talking about, there's no way you will get it because you don't know what's your next. But once you know what's next, it makes it. So practice. Dr. Mahdi mentioned that rehearsal by yourself, in front of your colleague and mentor. Find your way. It's a learning curve, but once you get it, like you said, Dr. Leyton, it opened doors for you. And for the next LCC Congress next year, maybe we can invite you once we hear that you give a good presentation. Dr. Elkhammas, I would love to hear your final remark. And if you want to say it in Arabic, absolutely, you're welcome.
No, barakallahu feekum, Dr. Leyton. It was really a great presentation. I don't have anything to add. I think a great audience, and I wish them the best. And if they have any questions, Dr. Leyton email is there. My email, Dr. Smear has it. Dr. Arki, I'm sure, email, and you're more than welcome anytime. We are here really to help.
Okay, thank you so much, Dr.